Hello. Should I go ahead? We're going to talk about, or I'm going to talk about, heartworm prevention in cats and the staff's role. So I'm going to define the staff. The staff, in my opinion, that I'm including here is everyone other than the doctor. So with our clients, unfortunately for the doctors, think that the doctors are present to be very important and to collect their money, because you guys make so much money. So with technicians, we are lucky enough to make friends with them and to be able to kind of get on their side, really. So the staff is everyone that comes in contact with that client. The first thing really to note about heartworm prevention in cats is a lot of people don't think that their cats are exposed to heartworms. They don't think that it applies to them. And I'm here to tell you that it does. It can happen. It really can happen. So I loved this picture with the cat on the couch. That is the experience that I have at home with my dogs. 25% of cats diagnosed with adult heartworms are considered indoor cats. I'm going to point out that's adult heartworms. So if we really know about heartworm disease, which we should, adult heartworms are actually mainly, they're not going to reach adulthood. So to me, that this is kind of important, stating that there's a possibility there are more of that are indoor cats. So if your cat can find its way to the couch, the mosquito can find its way to the couch as well. And 59% of our dog owners are giving prevention, 5% of our cat owners are giving prevention. That's very sad. And a lot of it has to do with us not promoting it enough. So I think that we should really show that we're behind it. We believe in it. It can happen, and so we want to help prevent it. It's really the only option that we have, because treatment's not an option. So we really need to increase the amount of cats that are on preventative. As the staff, you need to know what heartworms are. You need to understand that it is a serious progressive disease. It's not the same disease as it is in dogs. It behaves differently. Like Dr. Berry said, cats, they march by the beat of their own drum. They're kind of their own unique animal. If you want to see a well-vetted, adult, grown man or woman be afraid, sometimes you can position them with a cat. You can give them a scary dog and a cat, and they're going to choose the dog, because the cats are scary animals. We know that they want to rip our flesh off when we're examining them and things like that. So I kind of look at heartworm disease the same way. So their bodies are much more able to fight off the microflaria, which is what is going to lead to the heartworm disease. So in my clinic, I'm known as the cat wrangler, which I love that role. That's my favorite, one of my favorite things to do. So I consider myself to be that larvae that makes it into becoming an adult. I actually got past the cat, and I was able to get past all of the scary defense that they had. So that's kind of my analogy there. With education, if we don't understand that heartworm disease in cats is an actual thing, and that it's not always something that we're going to know that they have until possibly they die. And we want our owners to know that. We need to know that ourselves. We need to know how it's transmitted. We need to explain to them, because we need to educate them. So we need them to understand that heartworms are something that other animals that are in their neighborhood and in their environment, it's coming from them through the mosquito. So it's not, a lot of times they kind of feel that they want to, at least for me particularly, kind of bubble their animal. That would be great if we could really do that, and sleeping under the bed all day long may be a little bit safer and keep us a little bit more protected from the mosquitoes. However, they can still find their way in. So we need to educate ourselves about heartworm disease, treatment. There really is not a lot that we can do for that, and prevention. So we need to understand diagnosis as well. Heartworm testing can be very confusing. So I work with students. I work at the University of Florida, and I work with students, and they get very confused. Do I test this cat every year? Okay, well, what does that mean? What if you get a positive antigen test? What do you get a negative antigen test? You really can't just use that test as a true answer. You need to put that together with an antibody test. So there's different things that are done: the antibody test, the antigen test, taking radiographs, doing an echo. These are the different things that we can do. This gets very expensive. We don't want to have to do this. If we suspect that this is going on, let's prevent the heartworms and never get to that point. Testing is important. It's something that you should do every 12 months. 12 is a big number with heartworms. You need to test every 12 months, and you need to prevent every 12 months. So treatment in heartworm-positive animals. Okay, so we've got our antigen test, we've got our antibody test, maybe we've done some radiographs, we really suspect this is going on, we've got some proof now. What can we do? Well, hopefully we're not at the point of having to stabilize our patient. Maybe that's what we need to do if they're coming in critically ill with respiratory distress. Prednisone, bronchodilators, it's going to present a lot like asthma. Vomiting in a cat, lethargy in a cat, that could be anything. That could be anything. So if they're coming in with coughing or asthma-like symptoms, could be asthma, it could be heartworm disease. So we're going to, if that is the case, we're going to treat with bronchodilators, prednisone. Surgical extraction, not recommended. Melarsoline and miticide injections, not going to happen. So treatments are our only method. That's what we got. So treatment, or prevention is the best thing that we've got on our side. You've got to know your preventions. If the staff doesn't know their preventions, how are they going to sell them? How are they going to explain to the owner? You want to see a very confused look on someone's face, have a client ask a veterinary student fresh out into clinics, what heartworm prevention should I be using? There are so many options. With cats, there are lesser options. There is milbemycin, there's ivermectin, so you got some oral options, you've got some topical options. It's really helpful to talk to your owners and find out, is their cat going to run from them every time that they get that topical preventative out? Well, let's talk about an oral preventative. If they don't take the oral preventative, let's do the topical preventative. So it's important to know what the options are and to understand, okay, so if I have something that has ivermectin in it, I know that's going to be HeartGuard. Okay, well, what if someone comes in, they say, I'm giving my cat preventative, and you say, what is it? And they give you a name they don't know. Well, you can look that up and potentially find out that it is maybe a generic version of something like this, and you've got more of an idea of what you're working with, what you can recommend, where you can go from there if they're on a good product. So knowing your preventatives is important. Knowing the cost of your preventatives is important. Stressing your preventatives is important. So we've got to talk to them also about giving the preventative. They need to give that every 30 days. Not monthly, every 30 days. We have a lot going on, pretty much, most people do. Veterinary people in particular, because we're out there saving all the animals that show up randomly at our house. So with that being said, we need to really talk about that every time with our owners and talk about what options there are and discuss these things. You got to ask questions. So we've got to ask questions about them. What are you using? Particularly with dogs, I get the answer a lot of times of a flea preventative. With cats, potentially you get that, potentially you get nothing. You get no answers at all. So it's a perfect time to have a conversation with them. Sit down with them and say, hey, I really need to explain to you how heartworms are contracted by your cat, how your cat's going to get that. And let me tell you how terrible it is when they actually have heartworm disease. You need to explain that to them. I'm not trying to scare them per se, but this is your time to have a conversation. This is your time to relate with that client and to find out what their thoughts are. Maybe they don't do it because they didn't know that cats actually got heartworm disease. Well, they need to know that, and they need to know how important it is, and they need to know how dangerous that is. They need to know about heartworm-associated respiratory disease. They don't want to nebulize their cat. They don't want to medicate their cat. If they don't want to give something every 30 days, they're not going to want to do all the other things that it's taking to supportive care. So let's talk about every 30 days, given that preventative, 12 months out of the year. Are they happy with their current product? Are they not happy with it for some reason. That's something important to talk about. Every time they come in for a visit, we need to talk to them about what preventative are you using? How often are you using it? Are you happy with that product? If you're not, there are plenty of options. There are new ones all the time. Let's talk about something that's going to be good for your cat, something that you can handle, something you're comfortable with giving. Maybe cost is a concern. So we need to kind of have an idea of what are lesser options, lesser costing options. What kind of rebates are out there? Specials and promos, and everybody loves promos and coupons and things like that, so let's share them with them. Keep up to date with things. Always ask if you can refill their medication. Like coming in for a regular visit. Do you need a refill today? Is there anything else I can do? Can I explain anything for you? You understand? Great. Every time that I get a client in, I'm just doing a repeat UA. I can go ahead and get that done for you. I get my history. Before I go take your animal, do you need any more heartworm or flea prevention today? I kind of wrap it up together. Sometimes, if they're on board with flea preventative, you can see fleas, you can't see heartworms, so that's kind of a hard thing for us. That doesn't necessarily work in our favor all the time. Although, if they do see fleas, they want to prevent fleas, they want to do regular prevention for that, let's tag along a heartworm prevention. Let's start by recommending a preventative that actually has heartworm prevention in it, not just flea preventive. That's a great time to have that discussion. Really, the staff needs to take every possible opportunity that they can talk about it to educate their clients, to educate their peers. They need to do that. That's what they should be doing to support the veterinarian. So the veterinarian's role is to be there, being a doctor, making hard decisions, coming up with diagnoses and treatments. This is what we need to do. This is what the staff needs to do. You need to be focused, the veterinarians need to be focusing on the really hard stuff, and we need to be focusing on getting this preventatives in their minds. We need to get it into their hands. We need them to get home with it and put it on their cats or in their cats. That's what's really important. Follow-up. So a really good thing to do for follow-up is, if you've just started them on it, a kitten, you're going to see them in a few weeks. Talk about it. Do you need more? How did it go? You didn't apply it? Let's do so. Let me explain why you should do that. Call them the next month. Hey, how'd that Advantage Multi, how'd that go? Did they not use it? If you find out in 1 month after their annual that they did not use that heartworm prevention, then you can get them on it right away, rather than having them come in 12 months and finding out at that point they never gave that. They just shoved it in the drawer and never even gave it. So that's 12 months worth of possible exposure that they've had. So what if we get a test and we find out that they're positive? What are we going to do with that? They could potentially be getting reinfected. It's proven that it's in their area. So we should follow up. We really need to make sure that they're doing this, making those phone calls. So a good idea for a clinic, and this is just a good outreach method. Get a person, a couple people, staff members, that are willing to take a few times out of their day, maybe just pick 2 times a month, the beginning of the month, the middle of the month, and make some phone calls. Get some people when they come in. If you find somebody, they're having trouble giving it, they're not giving it on a regular basis, offer a phone call. Hey, you know what? I do phone calls twice a month to remind people to give their preventative. Would you like me to put you on my list? I send out emails every month. I send out emails every 2 months. I love to add you to my group email. It's just a good thing to do, and you're making a connection. Again, it's more times talking about it. You're keeping it on those cats, in those cats. You're helping them out. We need to really believe in it, and I think that's a really important thing. Believe in it, follow up, get them prevented, save some cats' lives. Thank you.